Assalamu alaikum warahmatullahi wabarakatuh. I am Professor Doctor Hafiz Shehzad Ashraf, working as Head Department of Urology and Kidney Transplant Surgery in Shehzad Hospital, Lahore.
In your opinion, does the financial status of a patient determine what quality of healthcare they will receive in Pakistan?
Financial status definitely have an impact on the treatment available for the patients. Those patients who are rich and financially stable patients, they may get the treatment from the private hospital in which all the types of treatment are readily available and different consultants of different specialties are available, while in public sector hospital the burden of patient is so much high that uh, usually the poor patient who cannot afford the private sector hospital, they go to the public sector hospital where they have to go to uh, they have to meet to the doctor or the consultant in a long queue, and they get a long appointment time, and even for if they require a surgery, and they get a long appointment period for the surgical procedure.
What are the possible steps that can be taken to ensure that all individuals receive quality healthcare no matter their financial situation?
In my opinion, the quality of treatment, I think so, in public sector hospital and the private hospital are usually the same quality, but the difference is that in public sector hospital, patients have to wait for a longer period of time to get the treatment plan, while in private hospitals, they get the treatment earlier as they require. The quality of treatment will be same, but the difference is that of the waiting time. So this difference, or this difference in treatment plan, or is due to the financial status. The rich get those who have the financially stable status. They get the treatment from the private hospital, which are readily available. Those who don't cannot afford, they go to the public sector hospital, and they have to wait for a specific period of time to get that treatment. If this discrimination and unequal distribution of the money is the main reason for this different types of treatment or different modes of treatment in a private or the public sector hospital.
Are any steps being taken to resolve this? If so, how effective have they been?
Sehat Solat card was started for the treatment of all the peoples of Pakistan. That helped a lot for poor people, but there was no such benefit which was required because the health card, the Sehat Sahulat card was supplied to every people of Pakistan, but there must be some specific limit for that. It must be reserved only for those people who cannot afford their treatment. There must be a planning regarding the treatment available on health card. The income, we must check the income of the people, or there are different criteria for checking the financial status of the patient. Then we must limit, initially we must limit this health card to those specific people. It must not be available because it was misused in the past time. The second thing is that uh, government must start different centers, and different trust institution must come forward for the healthcare system of the people of the Pakistan.
Is there anything that the common man can do to help with the problem of lack of access to healthcare to poor people?
Everyone can put his share in this healthcare system by any means. Like a simple man, if he pays his dues to the government of Pakistan, and one thing is that the Islamic taxes, if one pays regularly 2.5% of his income, uh, by any means, it may be used on the poor people, on the healthcare system, or if the taxes which are applied by the government of the Pakistan, everyone pays that properly, so then these funds can be used on the healthcare system. It is requested to all the people of the Pakistan that they must pay their dues, the Islamic dues and the dues applied by the government of the Pakistan, so that we may raise the funds for the poor community.
Thank you for giving us your time and enlightening us with your knowledge.